Let's do a quick overview of the nursing process. It is very important, especially in nursing school, to know what the nurse is doing in each phase. So, to remember each step of the nursing process, we use the acronym ADPI. A for assessment, D for diagnosis, P for planning, I for implementing, and E for evaluation. Now, let's do a quick overview of what we do in each phase, and we're going to break that down and simplify it as best as possible. In the assessment phase, the nurse collects, organize, and document the data. This can be obtaining the client's vital signs, their nursing health history, reviewing the client's record. You may need to speak to the client support system in order to get more information depending on the client's mental status or their age. Now, once you collect all this information, you need to organize and validate them. Make sure they are significant and accurate. Now, once you collect all of this information, verify them, they're accurate, we are going to move to the diagnosing phase. In the diagnosing phase, we will be analyzing the data that we collected in the assessment phase to form our diagnosis. We utilize the abnormal data to form our diagnosis. So we are not using the normal data. We are using the abnormal data to form our diagnosis. So this is very important for you to know. In order for you to use a nursing diagnosis, the client must have at least 3 characteristics or signs and symptoms of the diagnosis that you are using. If it's a case that you can't come up with 3 characteristics, do not use it. It's not correct. Example, your nursing diagnosis is hyperthermia. In order for this to be accurate, the patient must have at least 3 signs and symptoms of hyperthermia. This could be temperature of 102.6, chills, skin is warm to touch, or tachycardia, something, but it has to be 3 characteristics or more. So once you have completed your diagnosis, you need to move on to the planning phase. In the planning phase, we think of ways to prevent, reduce, or resolve the identified issue. This is where we set goals for the clients. What are our desired outcome for this patient? What are we going to do to fix it? So for the diagnosis of hyperthermia, we may set goals such as patient temperature will be between 97.8 to 98.6 within 24 hours of hospitalization. Patient will report decrease or no chills within 24 hours of hospitalization. We can talk about the patient's heart rate will be between 60 to 100 within 24 hours of hospitalization. Just to add, make sure your goal statements are specific, measurable, attainable, realistic, and make sure it has a time frame. So you can use the SMART acronym to remember that. You can't set a goal statement for, say, a diabetic to be cured of diabetes within a certain time frame. That goal is unrealistic and it makes no sense. So we have to be realistic when it comes on to our goal statements. For our hyperthermic patient, we would not set a time frame for them to be afebrile within 1 hour, because that's unrealistic. It wouldn't make sense. So we don't want to do that. So now that we have planned our goals, we need to start doing things to achieve those goals. So we will move to the implementation phase. In this phase, the nurse is doing things to achieve the goals that she has set for her patient. I call this phase the doing phase. We are assessing and monitoring the patient. We can do it ourselves or we can delegate for the patient's temp to be checked every 4 hours. We need to be asking patients about their signs and symptoms. Are you still having chills? We need to be monitoring those vital signs. We need to be administering meds, monitoring I's and O's, because at this point, the patient is at risk for dehydration. We need to make sure that we are preventing that. To determine if our goals were accomplished, we need to move to the evaluation phase. Now, in the evaluation phase, we are reassessing the patient. We are checking if those abnormal data we had are now normal. Is the patient temp between 97.6 to 98.6? Is the patient still reporting chills? How's the heart rate? Is the patient still tachycardic, or is the patient's heart rate between 60 to 100? If you were able to achieve your goals, then your plan worked. If not, we need to go back to the drawing board and start over. Hopefully, this brief explanation was helpful. If you have any question, please reach out to me at nursing@nursing schoolmadeeasy.com.